We want to thank all the volunteers and all the colleges and all the businesses and the faith communities and the Rotaries that are here as volunteers. And we have no better supporter than our friends at the University of Maryland, Baltimore, who are represented here in such great numbers. And we've asked Dr. Jay Perman, the president of University of Maryland, Baltimore, to offer just a few remarks. Jay?
I have never felt prouder to be a Baltimorean than looking out here at this. Last spring, yes, we saw the pain of our city laid bare. Many of you in this room know this pain, live this pain every day. But today is about hope. Today is about making homelessness, as our mayor said, rare and brief. Today is about ending acute poverty in our city and dismantling the barriers to opportunity that prevent people from getting off the street and out of the shelter. If we come together as one community, as one Baltimore, we can do this.
Today, people experiencing homelessness will have the opportunity to access critical services like health care, dental care, legal services, housing resources, haircuts, and even care for families. Because of your commitment, we anticipate that we will serve about 2,000 people today. Project Homeless Connect represents one of the key components that's needed to truly advance the journey home, which is mobilizing our resources towards ending homelessness. It means so much that we are coming together as a caring community in one place to provide these resources.
My name is Aki. I'm a Christian and I'm a former United States soldier. It's been great. I'm a volunteer, but still I can take advantage of the different services. I got an, what's it called, hepatitis C test, which was negative, and I got an HIV test, which was negative. I just want to say, if you're homeless, do not pass up the opportunity. I'm assuming this will happen again next year, or even today, if you are hearing this today, September 24th, 2015, do not, out of pride or something like that, pass up the opportunity to come here and get help. Don't try to make it on your own.
Before this, all of my nursing school teaching was in the hospital here in Baltimore, and I've seen a lot of patients come in that already have HIV and AIDS and other preventable illnesses. And now that I'm in my last semester, our focus is on the community, and I realized that nobody likes to be in the hospital. That's never good, and so much of this is preventative. And by simply coming out here, doing a screening, it offers a chance to intervene with these patients early on and reduce the severity of the illness prognosis later on, so everybody wins. Prevention is the best medicine, and this is a great example of it.
I came here today with the School of Pharmacy, Operation Diabetes. I found out about this event through the American Pharmacists Association, through our school. I thought that it was a really amazing program that they were holding for the people in Baltimore, those in need that really could benefit from our services today.
Part of Operation Diabetes is just spreading general awareness because it is a very prevalent disease. At the School of Pharmacy, in our second year, we do test our own blood sugar, and so we can relay that to the patients that it is, if they have the disease, we understand what they're going through, and if they don't have the disease, we can understand, or they can hopefully understand that they don't want to have to prick their fingers every day to test their sugar. So doing these small things like walking an extra 10 minutes a day or eating more fruits and less processed foods, it can help. So hopefully we can inspire that message on them.
What we're really trying to push is allow families to understand that parents are their children's first teacher. Okay, and so that's our motto, and it's important that they receive structure and learning at home. And since we're dealing with a crises population, we want to just get that information out to them and allow them to utilize the tools and the knowledge that they already have to support their children and family.
I'm here today with the Maryland Low Income Taxpayer Clinic, and we're here to really just help anyone who has any tax issues, tax controversies that maybe they don't have access to a lawyer, they don't have, they don't have the funds to pay for it. So we're here doing, free legal work, really to helping, the community as best we can. I mean, I think events like this are amazing. I didn't know this existed, and I think they should happen more often. I'd love to participate next year, even if not part of the clinic, even if it's just a volunteer. I mean, I think especially, this is something that all cities really should have. Really just outreach the community. Where people that don't have the resources, give them available resources. So.
I've received some help regarding legal protection for renters. Some people have difficulty with their landlords. Some homeowners have difficulty with maintaining their housing, so they need to find out who to contact and who could represent them in whatever issue they may have with their housing situation. Particularly, I was looking for housing assistance, but to my surprise, there were a lot of other resources that were available to me this morning. Well, as you can see from my mouth, I've received dental care this morning that I was in need of for quite some time.
And what was that? Tell me about it.
I had my tooth pulled.
Today we're really doing a lot of emergency care, getting patients out of pain, removing teeth that have been bothering them for months. We just did an extraction for a patient who was in pain for over 6 months on this one tooth, and just examining him, I couldn't even touch the tooth because he was in unbearable pain. So we're doing a lot of emergency care, and then there are some patients where we're able to do fillings, do some restorative work on their front teeth so that they can smile with confidence, so they can go on interviews and hopefully, get a job and make a difference and feel good about themselves.
So just observing the dentists around, it's, you learn some skills, some actual dental skills, but you also learn a lot more than that. How to talk to patients, how to explain things to patients, how to calm patients. This is a very stressful environment, so anything that you can say or do to help a patient out, help a patient calm down, makes a big difference. This is a great opportunity to get back to Baltimore. There's a lot of need here, and this just scrapes the surface.